Posterior palatal seal area. Now, the posterior palatal seal area is basically that anatomical landmark which forms the posterior border of a maxillary removable dental prosthesis. So, it according to the definition, it's a soft tissue area at or beyond the junction of the soft palate and the hard palate, on which pressure within the physiological limit can be applied by a denture to aid in its retention. This forms the posterior border or the peripheral seal of the dental prosthesis. The functions of the posterior palatal seal are to aid in the retention of the denture by providing an air seal and also to prevent food and liquids from slipping under the denture. Now, when you think of it, apart from the PPS, all the other areas of the denture have an overlying draping of tissues over the buccal and the lingual borders, which provides an effective seal in these regions. However, in the posterior border of the maxillary denture, there is no such aid. So, here we require a different kind of a seal. Here, the posterior part of the denture not only has to have intimate contact with the tissues but also exert light pressure, has to have intimate contact and exert light pressure in order to provide an effective seal. So, the seal along the posterior border of the maxillary denture is known as the posterior palatal seal, and this is achieved by a raised area of acrylic on the posterior border of the denture, which is why it is very important to record the PPS accurately. So, the soft tissue area at or beyond the junction of soft and hard palate, on which pressure within the physiological limit can be applied by a denture to aid in its retention. The boundaries of the posterior palatal seal. First off, the major function of the posterior palatal seal is to provide retention. Keeping that in mind, the boundaries anteriorly are the anterior vibrating line and posteriorly the posterior vibrating line. Laterally, the pterygomaxillary notch. Anteriorly. Now, anterior vibrating line. See, this is an imaginary line located at the junction of attached tissues overlying the hard palate and the movable tissues of the immediately adjacent soft palate. It is bow-shaped due to the projection of posterior nasal spine, and it is located by performing the Valsalva maneuver. So the patient is asked to say "ah" in short, vigorous bursts, and both the nostrils are held firmly, and while the patient blows gently through the nose. This basically positions the soft palate downwards at its junction with the hard palate. The posterior vibrating line is an imaginary line at the junction of the aponeurosis of the tensor valli palatini and the muscular portion of the soft palate. So, this is, in simpler words, a demarcation between that part with shallow movement and remainder that is markedly displaced. So, the difference between the anterior and posterior vibrating line is this is the demarcation between the soft and hard palate, and in the posterior vibrating line, this is the demarcation between the area within the soft palate, which is freely movable and slightly movable. So, this is visualized when the patient says "ah" in a normal, unexaggerated fashion. The pterygomaxillary seal. Now, the PPS can be considered in two parts. One is the pterygomaxillary seal and the other is the posterior palatal seal. We've already discussed the posterior palatal seal by the anterior and posterior vibrating line. Coming to the pterygomaxillary seal. This is placed in the pterygomaxillary notch or the hamular notch immediately behind the maxillary tuberosity. Here, the notch. This can be This can be located by the help of a T-ball burnisher. Coming to the uses of the PPS, primarily retention of the denture. It also acts as a barrier, prevents food accumulation beneath the denture by providing an intimate contact with the tissues. It reduces patient awareness, compensates curing shrinkage, and the posterior palatal seal can be placed in an impression tray with the compound to prevent sort of a gag reflex. The problems with having a PPS that is overextended and underextended. So now if the distal border of the denture extends onto the active portion of the soft palate, one, it will make swallowing difficult. Over the days, areas of redness and ulceration will appear, and there will be a sharp pain during function in the pterygoid humulus region. If underextended, this will cause loss of valuable retention. Failure to identify posterior vibrating line causes this, and the use of other landmarks for locating the posterior border leads to underextension. It may also be the result of patients with extensive gag reflex where you can't fully take an impression accurately. So this basically causes loss of valuable retention, and overextension causes a difficulty in swallowing, areas of redness, ulceration, and sharp pain. So this was all about the posterior palatal seal area, and the next video will talk about the techniques of recording the PPS. Thank you.